Hi, my name is Bruce Slane. This is a follow up video to my video that I made in relation to Jordan Peterson's health and current condition. I'm going to go through some of the commentary that people posted on that video. Just a quick disclaimer: this is not legal or medical advice. I did not speak to any of Jordan Peterson's doctors or family members. I did not read his medical records. This is my hypothesis. I base and my speculation. This is based on the video that his daughter, Michaela Fuller, put out with the update on his condition. And she put out two videos, and she did an interview with Piers Morgan. So that's what I base it on. So let's go through some of the commentary people posted to my video. One commentary after I did that video. This is pure BS, Bruce. The medical institutes have been pushing propaganda for years on the COVID virus and vax. Medical students have only one mandate, and that is to push big pharma drugs to enrich mega giant conglomerates and themselves. There is so much info on the adverse side effects. If you had half a brain, are you working for them too? No, I work for myself. Uh, so, it's if you don't want to take a vaccination, don't take a vaccination. I'm a libertarian. I have a significant medical issues, so I take vaccinations. I mean, that's my choice. This is a free society. It's Do I take a tuberculosis vaccination? No, it's not indicated for me. I don't live in Africa. There's some parts of Africa it's dangerous though. But if you don't want to take a vaccination, don't take it. I did take for this season. I did take my COVID vaccination, and I was just exposed to like two people with COVID. They were like coughing in my face. I didn't wind up with COVID. I don't know whether if the efficacy of it for this round is better or less. But if you don't want to take a vaccination, don't do it. I no, I don't get. If you look at my views, nor would I want to take any money from pharmaceutical companies. Uh, Pharmaceutical companies they make their money off of weight loss drugs, and which are effective. Actually, some of these new ones I'm going to make a separate video on it. This is not legal or medical advice. You ever had hair loss or erection drug? Yeah, they make money. That's how the system works. But they also create medications that save lives. I'm sitting here today. I survived a cancer with a 5 year, 10% survival rate. So there are medications involved, something like that. So I believe in the healthcare system, but you have to manage it properly. You really do. Someone who didn't believe, I think Jordan Peterson has a history of not of distrusting it, and that can have negative consequences. So here's a comment. I think IQ has dropped after his treatment in Russia. Not to 80, but lately he certainly didn't have an IQ of 150. So his daughter posted that he was suffering from nerve damage or respiratory issues that most likely affected his focus and whatnot. But that's not brain damage. That's not. So when he was in Russia, is my understanding, he had pneumonia. You don't do that. You don't fly to Russia for medical treatment. And this is my whole point. If you don't trust, he saw five different psychiatrists before he flew off to Russia. If you're not trusting the medical care of the United States and going, no, no, this medical care is not going to do it for me, and then fly off to Russia, this is indicative. If something's going to happen, you're not listening to a doctor in the future in America. You live in America. It's different if he was Russian. So no, he went for a program that was not approved, and they did crazy stuff. They sedated him, and but the Russians kept him from going into septic shock. So he pulled out of it, and that he kept him from being septic. So in that sense, that was good. But in the current sense, this is horrible. What's happening to him now? What happened to him essentially? Let's go through another question. My dad was 6 weeks in the ICU with double pneumonia. So it happens. He fully recovered, thank God. Thank goodness. Poster. I'm so happy that he recovered. You know that if they tackle it and they culture the sputum and whatnot, they could really treat it very quick and get them out of the ICU before you go septic or before you get into septic shock. So that's wonderful, and that's the idea. If you have an understanding of that this can happen, rather than wind up with an ambulance at your door, carting grandmother out to the hospital, you're there at the ICU 5 days earlier, and they're treating your family member for something like this. Um, so here's some further stuff. 1997, I was diagnosed with mesothelioma, and my right lung was surgically removed. This was attributed to asbestos exposure. Today, I'm an attorney, and I fight for the rights of injured victims. My name is Bruce Slane, and if you or a loved one was recently diagnosed with mesothelioma, call me. I'd like to speak with you. Big philosophy. I'm health, legal, safety. That's my things. Although I enjoy listening to Jordan Peterson in relation to those things. Um, I think that if he there's a certain point he was a therapist, and therapists, if they're giving therapy to someone, part of the standard of care, if someone is suffering from a health condition, is to tell that person, well, go to your doctor, go to that specialist. Well, you could go to this specialist, go to your specialist. And then they come back into therapy. Oh, I'm still aching. I'm still like, what did the therapist say? Go back to the therapist. That is generally, and I'm just speaking generally, my understanding, the standard of care of a therapist and their patient. So he would be counseling. I would imagine he would be telling his patients through his career to go back in. When he gave that, when the Canada restricted his license and he was just doing his tour or whatnot, I think he lost something there. He lost that what he would counsel patients. I would imagine that working with your doctor, develop a relationship with your doctor to get the best health care you can get. And so he went for years without diagnosis of conditions. I don't think he understood what's going on. He has autoimmune conditions. So you get treated by an immunologist, an allergist. It's a double board certification. So they should be have running tests, um, allergy tests, blood work, you name it. And you need to be working with his doctors to get himself to the best that he was doing this alone, essentially. Um, so let me see. I have listened to 10-minute point when you actually believe just because they are doctors, you're just supposed to trust them. Pertaining to your vaccine comment, every jab and prescription is dollars in their pocket. First of all, I've done research, and the shortest time in history to develop a real vaccine, I believe, was 12 to 14 years. Not what, 2 months? So, um, COVID, they've given hundreds of millions of vaccinations out on it. Just to give you a background, I give you my background before this. I do medical malpractice in New York. I practice vaccine injury litigation in the federal court claims, and I represent mesothelioma victims and their families. So that second thing, um, I represent people with very serious vaccine injuries. I represent some of my clients have died from vaccinations. I've seen the worst. There's about 100 of us in the country that's seen the worst of the worst vaccine injuries. That is rare, though. These injuries, shoulder injury from a vaccination is not that rare. An injury in relation to Guillain-Barré from a flu shot, it's 1 in a million, and you could get Guillain-Barré from the flu. cardiomyelitis, and I don't. COVID vaccinations are not part of the vaccine compensation program, so it's part of a separate program that I don't litigate in. So I don't really do litigation on the COVID vaccinations in relation to whether they're safe or not. You can. It's my understanding, based on the literature, yeah, you could get cardiomyelitis from a COVID vaccination. You can. I've spoken to many people. Why is I've spoken to many people? Because they call me because I do vaccine injury litigation. But I've spoken to many people who've gotten cardiomyelitis from COVID. So COVID is horrible. It's been running havoc through the United States, through the whole world. It's causing people are dying from it. It's lousy. We should have never had to take any damn vaccine. Excuse me, my vaccination for COVID, because it shouldn't. We shouldn't have it. It's ridiculous. It's horrible that to have this. So I think that is it's just unfortunate that we do have to take any, or or don't take it. But if you have COVID symptoms, I wouldn't hang out with grandma. Stay away from her because you get her sick. So here's another one. Let me get this straight. You don't have any of his blood work. Any of his diagnosis is anything but his daughter said, which is very general. And you're going to do an IQ is dropping an IQ points, and he's dropping IQ points. You're ridiculous. Your judgment. You're jealous. You have no idea what you're talking about. You should never talk about people or things if you don't have, and then a cutoff. Um, all right. Well, look, I hope nothing happened to him in terms of his any hypoxic injury to his brain or anything like that. I hope, but that's not. I mean, let's talk about reality. He was in ICU for 3 weeks, and he was septic. So if you have severe sepsis, you're in septic shock, and it's. I mean, I've seen a number of cases. And it's just sad. They come out of, they go into septic shock, and then you see the the patient, and they can't even walk, and they're in rehab, and then they get to a level of a baseline, and it's just that much lower. So it is horrible. I hope that this is just a psychosomatic, a psychotic break, that he was confined and he just had a psychotic break and he's able to pull himself out of it. He's strong. So he is strong. And if it was a psychosomatic thing, I think he would have pulled himself out of it already. I really do. But this is what happens and with when you become septic. This is why you don't want to become septic in an ICU. You don't. Whether you take a vaccine or don't take a vaccine, fine. But if you get congested, you get yourself to the emergency room. And if they send you away, you go back to the emergency room and say, "What the heck? Did you do a chest X-ray? Did you do my blood work? What the heck? What is that?" So what I've listened to, and what I would, normally when I go through a case, I have stacks worth of medical records. I have my emergency medicine physician. I pour through everything as I'm going to be deposing the doctors in relation to that. Yeah, so that's ideal. I could split it apart. I could say this hospital screwed up. They should have done X, Y, Z, and then and have backup of the expert. So I'm limited, but the family members should know what the heck's going on with his condition. Jordan Peterson has a chapter in his book, "Speak Clearly." So that's not what has been done in relation to his health. I wish him the best of health. I really do. Let's see if I can do one more. This is pointing out the fact that you said he made a bad judgment, but you didn't make one at all. I'm skeptical like you, just not a freak. This video was interesting, and he said multiple times it is just his opinion. LOL. Just calm down, guy, and stick to your Facebook forum. I don't know. You're talking. I don't. I don't even know if my Facebook is up. Um, well, I hope that someone saw it and out there and hit like and hit subscribe. But I also would hope that someone saw and be like, wait a second, I'm having trouble breathing. And my doctor gave me a Z pack, and I'm still having trouble breathing. I gotta get to freaking ER because this is not good. And then you get to the ER, and then they're able to treat them, and it's a good outcome and a good result. I'll tell you a story. This is one of the. I'll tell you a story. I tell clients, clients come to me and they complain about the medical care because I sue doctors. That's what I do in part. And uh and usually I will say, look, you're complaining about the doctor. The doctor is going to we sue him. This is what the doctor is going to say that you didn't do. So then now they're going to blame you and you're blaming them. And so you shouldn't do these things. This is how you should handle your care. If you're going to bring a lawsuit, they're going to be saying they're going to be pointing the finger at you. And so, and one case, and there's a number. I can give you many examples. Well, one case, I had a client is explaining to me, well, I had chest pain, and they just sent me on my way, and it didn't turn out to be anything. I'm like, well, why didn't you go back? If your pain was then getting worse after that, it's axiomatic. You go back. They even tell you. A lot of times they give you a sheet and there's small writing. If you continue having pain or whatever, come back to the ER. But they'll say, oh, have you, it doesn't maybe you have some stomach pain. So I'm like, you'll get back to the ER if you are still having pain and it's getting worse. That's it. And bumped into him 4 months later. And he's like, I had I had pain in my side, and they sent me home, and they're like, it's nothing. And I was listening to your voice, and I'm like, screw this. And I went back after a little while, it was getting worse. I'm like, forget it, I got to get back. And I didn't wait, and he got back. It was appendicitis. They rushed him into surgery. That's a good outcome. That makes me happy. Those stories. I'm not going to hear stories like that necessarily because I'm not working with anyone directly. But I wish everyone good health. I wish Jordan Peterson good health. I wish that his family good health. I think that for everyone out there, you have to know what's going on with your health. When someone goes, "Well, we don't know," they don't know. Yes, they know. You have to know what they know. You have to have an understanding what you are suffering from, and that's the way that they're able to treat it and be able to manage it, rather than that they don't know. Well, then they have to figure it out, and you have to work with the specialists such that they do. A lot of times, the treating doctors will give broad statements. I have family members that are doctors. I was just talking to oh, we know. It's just, what are you gonna? I'm like, that's outrageous. You know, you have to. The patient has to know, and it's not fair really for the patient to write something like idiopathic in the medical records. They don't want to lock down on their differential diagnosis because it could be this and it could be that, and if they just lock down on one specific thing, it could affect the treatment of the patient for the future. So, yeah, I mean that's part of the reason why they do it. There's other reasons as well. But thank you for your comments, and thank you for watching my channel. I have more postings coming up of different topics, and again, I wish Dr. Peterson's family and him good health, and I wish everyone good health. Take care.